Okay, Sam, so we're now going to run through a blocked tracheostomy scenario. Can you tell me what you would like to do for your safe approach to the patient?
First thing I would do is to check my area to ensure it's safe. I would stimulate my patient and shout for help, if necessary putting out a 2222 call.
Great, and what would you like to do with regards to assessing your patient's airway?
The first thing I would do, as mentioned earlier, is that I would check under the patient's tracheostomy dressing to ensure that the tracheostomy hasn't become dislodged. I would then ensure that the patient is properly positioned to aid easy access to the tracheostomy and to open the airway.
Great, and what would you like to do next?
Please could I have some oxygen, as I'd like to apply some oxygen to the patient. And if necessary, if the patient is ventilated, I would consider looking at the capnography on the monitor.
As we have now confirmed that this tube is definitely in, we can move on to assessing the tracheostomy patency. So to do that, we're going to remove the attachments that are on the end of the tracheostomy, in this case an HME filter, and we are going to attempt to suction the trachea.
So I'm going to remove the HME filter. I've got a size 6 suction catheter as per the patient's information, and I'm going to attempt to pass it to 7 centimetres. I cannot pass it to 7 centimetres.
So as the patient is desaturating and you cannot pass the suction catheter, we can assume that we have got blocked tracheostomy. What would you like to do next?
Next, I would like to remove this tracheostomy and to try replacing it with another tracheostomy of the same size.
Excellent. I'm going to remove the blocked tracheostomy. Sam, are you ready to insert the new one?
I am.
So now we've reinserted the new tracheostomy, we're going to assess our patient. And I've just noticed that this patient's respiratory rate has slowed right down and they look like they're going to stop breathing. So we now need to move on to the life support portion of the algorithm. And I'm going to give 5 rescue breaths using an ambu bag. As I'm doing the 5 rescue breaths, I'm checking for chest rise. As the baby has now started breathing again, I need to disconnect the ambu bag, as Daisy can't breathe against the valve in the ambu bag, and go back to administering oxygen via a mask. If she hadn't started breathing again, we would need to check for signs of life, and if necessary, commence CPR. In this scenario, we managed to get the tracheostomy back in before we needed to perform rescue breaths. What could we use if we didn't have the tracheostomy back in and needed to perform rescue breaths on the patient?
We could perform standard airway manoeuvres as they may be appropriate. So if necessary, we cover the stoma either with swabs or with a hand and use a bag valve mask over the face, oral or nasal airway adjuncts such as a Guedel, a subglottic airway device, for example, an LMA. And then if necessary, we can move on to ventilating the stoma by occluding the mouth and using a small face mask to ventilate the tracheostomy stoma.
That's correct.